Hi, and welcome to the Wellness Blueprint with Tim and Christy, where you are empowered to change your health.
Hey, welcome back to another episode of the Wellness Blueprint with Tim and Christy. It's been a little bit. We took a little break.
We had the holidays, had Christmas and New Year's, and so now we're back at it.
Yeah, we're back full force. So what are we talking about today?
We are talking about fibromyalgia.
So there's a lot of people diagnosed with fibromyalgia.
Don't you wish you had a nickel for every patient that's come in, and they tell you about everything else, and then in the history it's like, oh, by the way, got fibromyalgia.
Right.
And so it's more common than people realize, and it can be really frustrating as well. Traditionally, you remember when it started out back in the day and people were starting to get diagnosed with it, but it had that persona of it's not real.
Right.
But,
or you only get diagnosed with that when they can't figure out what else is wrong.
Right.
So.
But there's a few things. One, it is real.
Very real.
Number two, it is reversible, and a lot of people don't realize that. So this is going to be an important segment on that because it is reversible. And obviously, it's not reversible by using drugs. It doesn't mean that drugs aren't important with that in helping with some of the symptoms, but it doesn't reverse it. And that's the frustrating thing is people have it year after year after year.
I think a lot of patients, too, think that there is some type of magic test that will diagnose fibromyalgia.
Aha.
And they think that there's a blood test that their doctor's going to run to diagnose that. So do you want to go through how fibromyalgia is actually diagnosed?
Well, yeah, you got my head kind of spinning now because I'm gonna ask you a question here in a minute.
Okay.
But one of the things that in the literature that it says is common, it's 2 to 3 times more common than the general population, is something called substance P. And so when substance P is found in the cerebrospinal fluid, then there's an increased chance of fibromyalgia. So here's my question. How many patients have you had that have had their cerebrospinal fluid tested for substance P?
0 that I know of.
Same here.
Right.
I had one today. I said, have you ever had your cerebrospinal fluid tested for substance P? No. I said, in 37 years, and of course, fibromyalgia hadn't been around for that long, but I've never had a single patient be tested. In fact, I would really recommend that you go get tested for substance P.
Because that's a spinal tap that you have to get your spinal fluid tested for that. So not everybody's just going to the doctor going, hey, can I have a spinal tap and look for substance P?
Substance P. So, but the good thing about that is it does show people that it is a real problem, but no one ever gets tested for that.
Right.
Now, traditionally what they would do is they would look for trigger points. So tell us a little bit about trigger points. You got patients that have those.
Oh my goodness. Well, most of my patients have trigger points in their trap areas. They can have them in their lower back and their buttock, even buttock areas, down the thighs, knots in the muscles. You can usually feel them.
Right.
And there's some techniques that you can use to get rid of those. And I try to tell my patients how to do that so they can do that at home, because just being with me for 15 minutes, once or twice a week, it's not going to take care of those trigger points. Massage therapy is good for that.
Right.
So.
The interesting thing is that they've started kind of backing away from it. And I always kind of wondered, because I know you're like me, who doesn't have trigger points?
I know.
I mean, now it's worse on some people than others, and depending on how your work environment is.
And how long they've been going on. If you've not done anything for them, they can get worse over time.
Yes.
So
they've kind of backed away from that traditional 11 out of 18 pairs of trigger points and kind of gone on to some different pain scales. If you have pain in these different locations throughout the body, you have a chance that you have fibromyalgia.
Right. Well, I think it's important to let people know too, because I know a lot of my patients, when we're talking about fibromyalgia, they say my doctor's going to test me for fibromyalgia. I think automatically we just think, oh, there's a blood test or there's some kind of imaging. They're going to do some kind of scan. So just for the people out there, if you don't know how fibromyalgia is tested for, do you want to go through that?
So just like you said, there is no X-ray or MRI or CT scan or a blood test other than doing the obscure test that we had talked about a while ago. But none of those things can be used to diagnose fibromyalgia.
It's basically a process of elimination, right?
I think so, to some degree.
I know that they do, more extensive testing. Like I've read stuff like for thyroid testing and other like autoimmune to see if it's, related. But that is not diagnosing, a test for fibromyalgia. So
now, are those tests important? Yeah, they're important because if you want to look at from a structural standpoint or from a disc standpoint, the X-rays and MRIs and CTs and lab tests are important because you might have a lab test that shows, like you said, a thyroid problem or some autoimmune, but it doesn't mean that those are important specifically for fibromyalgia.
Right.
And so, don't be discouraged if you've done a lot of tests and you don't have anything that you can put your hand on. I'm gonna talk about some things that show up. I'm gonna just read through a few things as far as key findings. Widespread pain, and so you have it not just in one area like we see with.
It's going to be so many areas before. Yes.
Yeah. So it's not like just an injury to a muscle.
And you have to have the pain there for over
3
months.
months. Yes.
So it's not something that you're going to have an acute injury and then they're going to oh, that's fibromyalgia.
Correct.
So.
Yes.
Okay.
Fatigue, almost all and it doesn't mean that you have fatigue 24/7 constantly, but you have more episodes of
Come
fatigue.
and go.
Yeah, and as far as sleep, patients will say, even though I get plenty of sleep, I don't feel like it really makes a big difference with that.
Even if they're getting several hours of sleep at night, they don't feel rested when they wake up.
Yes.
So.
And then we have what we call fibro fog. And again, it's not one of those things where they feel like they're in a fog 24/7, but they have this brain fog where things are just kind of fuzzy. And so we have patients that come in pretty routinely and say, I just have this fog and I feel like I'm not really thinking as clearly. And that's aggravated a lot by stress. So you'll have this like I do. Every patient is different, and so when you're testing for trigger points, some people you can go deeper and test, but when you have fibromyalgia, just even the
lightest touch,
yes, makes such a big difference there. And so they have this heightened sensitivity, and so I think about it in terms of a dial. Okay, let's say you've got your dial on the radio. And so they have a central nervous system problem where the dial is cranked up.
Turned up high.
Turned up high. So that's a big problem with fibromyalgia. And so we talked about, you can have the trigger points like it was historically tested. It's commonly seen, but it really is a signal that's messed up by the nervous system. How many patients do you think in just the last few weeks that you've seen that have had fibromyalgia?
I would say at least, mean new patients or just regular?
Both, either one, whichever one you.
Okay, so out of all of them, I would say at least 40 to 50%, maybe higher. So, there might be some that I've, just forgotten they had it or something, so I've been diagnosed with it.
I think that's pretty accurate because for me, it seems like it's usually a secondary thing.
Yes.
That not do they always come in, I think they will maybe now after this podcast, but they don't always come in and just say, hey, I've got fibromyalgia.
Right.
What can you
Yeah.
do?
Yeah.
They tell you everything, and they go, yeah, also I have fibromyalgia. And so I think that's really important because we want to get the message out that there are some things that we can do at least to turn down that dial, that sensitivity.
Where they can manage their symptoms better.
Yes.
So that their nervous system's working better and they can, manage the symptoms better on a daily basis. So.
Yes. And when you have that, what we call the autonomic nervous system out of balance and they're stuck in that sympathetic mode, that fight or flight mode,
Right.
then it's a real problem.
Are there vitamin deficiencies that come along with fibromyalgia?
Yeah. Yes.
What do you see the most with that, like B vitamins or?
B vitamins are very important, but also things that enhance circulation to the tissue. So vitamin C can be important, vitamin E can be important. A lot of people these days are doing curcumin and turmeric and things of that nature. So anything that affects the circulation. And we're going to talk about in our next segment in part 2, we're going to talk about some of the cool things we have here.
That can help with the symptoms.
Yes,
Yeah.
that we've already been using,
yeah.
and then some new things
Right.
that we're really excited
That's
about.
awesome. Yeah, I'm excited about that. And so, yeah, stay tuned for the next episode of the Wellness Blueprint with Tim and Christy. Thanks for watching.
Have a good day.